Jessica Valdez.
Sorry.
That's good. It's good. I'm glad.
Mm.
Thank you. Jessica Valdez, we started working with Jessica last year. Um, when I first came here, we had our own United Healthcare insurance, but really nobody that helped us. It was just all a la carte, and it was just difficult, and the benefits weren't that great. So Jessica came into our lives, which is awesome. And they've done a great job at handling everything over this last year, from enrollment to claims to questions. So she's now is charged with sharing the enrollment, open enrollment with us. So thank you so much, Jessica, for your time, not just today, but just throughout the year. And your team. Your team is great. I have to say, my experience with them is very good.
Thank you, Linda. I'm glad to hear that. So for those of you that don't remember me from last year, maybe you're new, my name is Jessica Valdez, and I'm the benefits consultant for this year. So I look forward to another year working together.
Jessica, you were running off getting married last year, weren't you?
I got married, and my 1 year anniversary is actually this Sunday.
That's what I thought. It was right around here.
Yeah. I think you guys were my last meeting before my honeymoon.
Yeah.
So here, this year we're gonna do things the same. We're gonna use Employee Navigator, so you guys should be familiar with it. If you have any issues, questions, concerns, our team is here to help throughout the enrollment process. I'm trying to move this Zoom.
Did you guys get the Employee Navigator email yet?
I didn't see anything.
I know Tim said his came through today.
We could resend it. So if you haven't gotten it, you could let us know and we'll resend it. Okay. So this is a great segue. So
Wait, hey guys, for those of you, it went into my my junk folder, guys, and it says the external email. It says employee navigator, and then it has open enrollment, open parens, default, close parens. I got it last night.
Perfect. Thank you, Steve.
That's
so
good.
Our team is here to help throughout the year, not just during open enrollment, with any needs, questions, concerns that you have when you're using your benefits. So our service team is here to help with simple things such as finding a doctor, dentist, vision provider, maybe ordering an ID card, any benefit questions you have, or any additions or removals throughout the year with a qualifying event. Our claims team is here to help when you're actually using the insurance. So we have gap insurance. Maybe you forgot to show your gap card, or maybe you got a bill that you feel is incorrect. Our team will coordinate with the provider, with the carrier, and let you know, hey, this is incorrect and we fix it, and this is why, or this is correct and this is why. So if you ever have any questions and just need a little bit of clarity and guidance, our claims team is here to help, even with prescription issues or prior authorizations for diagnostics or procedures. So now during enrollment time is our enrollment team is here to help. So if you forgot your password, you need help enrolling, maybe you just want to give your enrollments over the phone, you can email our enrollment team. They'll set up a call with you, or you could call our office and ask for them. Our office hours are 9 to 5 p.m. My email is just like theirs, but it's my name, Jessica. It's also linked on Navigator, so you don't have to. I'm trying to skip enrollment for now. I'll show you after where it's at, so you don't have to remember it. But any questions you have, reach out to our team. Feel free to CC me so I can be on top of it. And yeah, we're here to help throughout the year. So it's open enrollment. This is the time to make your changes. So if you want to add coverage, change your coverage, add or delete dependents, this is the time. Throughout the year, if you want to make any changes, you could only do so with a qualifying event. So that would be marriage, divorce, birth or adoption, Medicare entitlement, or involuntary loss or gain of other group coverage. So I like to kind of expand on this one. So for example, your open enrollment is February 1st. But let's say that your spouse's open enrollment is July, and come July, you want to get on their plan. That's considered a qualifying event because you are gaining other group coverage. Okay. But besides that, throughout the year, these are the only events that would let you make a change. It's a law, and United does audits, and we want to make sure that no one is in a compromising position. Eligibility, you're eligible to get on the plan if you're a full-time employee, and the benefits start the first day of your employment. So now jumping in to the benefits. So during renewal time, I wish renewals would go down, but that's not always how it works. We get older, so we get more expensive. So our goal during renewal is to look out to see what's in the market, keep your contributions as close to the contribution that they were the previous year as possible without compromising benefits. So that's what we did this year. What we did was we got a plan that had a $6,000 deductible. However, we also raised the gap so that it would cover that deductible. So your major medical plan and your gap plan are going to be identical as a combination as they were the previous year. Okay, so I'm going to go line by line and explain how the gap works and how they work together. So your PCP copayment is $25. If you're going for your annual preventive visit, you get one per year. There's no cost, that copay is waived. Specialist copay is $75. For women, you're going to your OBGYN annual exam, that copay is waived. Office copays are not covered by the gap. So that's why we listed this here. Virtual visits, I wanted to point this out because there was a lot of visits in person last year that the group did that could have been virtual. The virtual visits, there's no copay. They're available 24/7, so it's a money and a time saver. So I just kind of wanted to remind you of that benefit. If you have something minor, let's say migraine, nausea, throat ache, something you could explain through the phone, I always recommend using HealthiestYou. They have PCPs, which are primary care physicians or general practitioners. They have specialists on there, and they even have mental health therapists on there for no cost. Minute Clinic, those are inside CVS. If you Google Minute Clinic, it'll show you the closest one in the area, and you can even put your spot in line, and that's a copay of $25. So doctor visits or doctor copays are not covered by the gap, and Minute Clinic virtual visits, that falls under that. So as you can see here, it's not covered. So what does the gap cover? Here we have $6,000 twice, and that's because the gap gives you two benefits. The first $6,000 is if you're hospitalized, meaning you're in the hospital for more than 23 hours. The second $6,000 is for outpatient benefits. Your outpatient services are emergency room, urgent care, outpatient surgeries, minor and major diagnostics. Okay, so if you do any of these services in the doctor's office, so if you have a surgical procedure or a diagnostic, the gap will cover that procedure diagnostic, but it won't cover the copay to actually see the doctor. So for example, if I go to the dermatologist, I pay my $75 to see them. If when I'm there, I do a biopsy, the gap will cover the biopsy, but I'm still gonna pay that $75 copay to see the dermatologist. ER is $300 after your $6,000 deductible. So ER visits usually range between $3,000 to $5,000. Let's say it's $5,000, that's applied to your $6,000 deductible. Now you've met $5,000 out of your $6,000 deductible, you only have $1,000 left to meet, and your deductible is cumulative. So as you go meeting it for any of these services, it goes adding up. However, you have $6,000 in gap to cover that $5,000 ER visit, so you pay $0. For the purposes, let's say, for example, your ER visit was $10,000. Not likely, but let's just say so we can understand how it works. If it was $10,000, your benefits read that you have to pay your $6,000 deductible and a $300 copay. So in the worst case scenario, you're on the hook for $6,300, but you have $6,000 in gap that would cover that deductible. So at $10,000 ER visit would really just be $300. Now you've met your deductible for the calendar year, and everything else would be $0. Urgent care, $50 copay, you have up to $6,000, that would cover that. Inpatient hospitalization, let's say your bill's $100,000, you only have to meet your $6,000 deductible, the gap has $6,000, so that $100,000 visit will be $0. Same thing with outpatient surgery. The gap fully covers the deductible. So whatever the cost is, the gap will cover it and it would be $0. Minor diagnostics, apply the deductible and the gap will cover it.
Jessica, can you go
Yeah.
back to that ER visit they had, the $10,000 hypothetical one?
Yes.
Tell me is there an out-of-pocket in that one in that scenario, or how does it work again?
So there's no co-insurance, which I think is probably what you're referring to.
Right.
So with the ER visit, you just have to meet your deductible of 6,000 and a $300 copay. So if your ER visit is above 6,300, meaning the ER bills the insurance above 6,300, that's the most you're gonna pay, but you have $6,000 in gap, so it's really 300. There's no percentage or cost share that leads to the out of pocket. So there's some plans
okay.
that it'll say 50% after deductible and you're responsible for those costs up to the out of pocket. There's no co-insurance here, so you just have this flat copay.
Gotcha. So does our $25 copay go against the deductible or no?
No, it goes towards the out of pocket, not the deductible.
Okay,
So
Okay.
wherever it says deductible is where the dollars would be applied towards the deductible.
got it. Okay.
Great question, Don.
So basically, Jessica, just so we understand, so really it's 100% it's covering everything after the deductible is met.
So I like to just be clear, you know, just because for the services, so if you meet your deductible, you see here it says 00000, you're not going to pay anything after the deductible is met. But let's say for the same purpose of example that I said, let's say you have that ER visit that's 7,000, it ends up being 6,300, your outpatient gap covers 6,000, you pay the 300, right?
Yeah.
Let's say you go to the urgent care a month later. You've already exhausted your $6,000 outpatient benefits, so you would pay this $50 copay out of pocket, but all these services would be covered 100%.
So is the easiest way to look at this gap is it really is covering the deductible?
Yes.
And is there any case where it doesn't cover something that would typically be against the deductible?
So I like to describe it as services because it covers your $50 copay here for the urgent care. So, but with this plan, all of the services that apply to the deductible, the gap applies.
Okay. Okay.
Okay. So for minor diagnostics, major diagnostics, and then for physical therapy. So physical therapy is a physical therapy rider. They'll give you up to $1,000 per person, capped at 3 people on a family plan for physical therapy. So it applies your $6,000 deductible. The gap only gives 1,000. So I just want to point that out because if you have to do, you know, multiple visits, you might be coming out of pocket depending on how many visits you do and how much that physical therapist charges.
Jessica, just a question about the family. So I see that the deductible is 12,000 for families.
Mm-hmm.
And the Transamerica is 6,000. So is that 6,000 per family member or
Yes.
6,000? Okay, just want to confirm.
It's 6,000 per family member. You only get the benefit of the family deductible or the family out of pocket if you have more than 2 people on your plan, because as you could see, the deductible is ×2 and the out of pocket is ×2. So if you have 3 people on your plan, and let's say, God forbid, you get in a car accident, all 3 of you guys go to the hospital, the insurance will just cap you at the first 2 meeting their deductible and their out of pocket since it's a catastrophic event. So, but in terms of the gap, everyone has their own gap benefit.
Okay.
Okay.
Thank you.
Any questions on the medical? I'll get to,
I guess, Jessica, I'm just trying to understand, how do I get an out-of-pocket maximum at all if this gap is covering the deductible and we're 100% after deductible?
Great question. So everything adds up to your out of pocket. When you don't have co-insurance, sometimes it's hard to reach that out of pocket. So you'd have to be going to your specialist a lot. You'd have to, yeah,
Okay.
you know, daily. You'd have to have a specialty medicine. So with these no co-insurance plans, it's kind of hard to get to the out of pocket. It's more when you have the co-insurance.
Okay, I got
That's a
you. Okay,
great
so
question.
so if it's like 20 ER visits to get to that 8,000, if you're
Yeah, which
Yeah.
I don't wish that upon any.
Yeah, right, yeah. You'd be working there if you're going that much, right?
Yeah.
Okay.
So it's gonna be very hard to get to this out of pocket. It'd be like a very extreme circumstance.
Okay, gotcha. Okay.
Okay. Your prescription drug tiers are not covered by the gap. Tier 1 is up to 10, tier 2 up to 35, tier 3 up to 75, and specialty 250. If you're taking medications and you want to know what tiers they fall under, this is a great example where you could reach out to our claims team and they'll let you know.
Yes.
Okay. And then this plan is a PPO. Now, I want to just expand a little bit on a PPO because it's a little bit of a gray benefits. So if you leave the network, you have some coverage, right? But you have to meet $12,000 out of network before the insurance starts covering 50%. I don't know about you, but I don't want to pay $12,000 out of network, and I probably wouldn't unless there was a catastrophic event. So you want to think about these out of network benefits for if God forbid you get some diagnosis and you want to see the best doctor who takes no insurance, you have some coverage there. The other gray area with it is that United will only apply to this out of network deductible what the costs are in network. So for example, I have a client, she sees a therapist. The therapist charges $300 per session. United's contracted rates with their in-network therapist is $150. So when she submits her claims to her out of network benefits, they're only applying $150, not the $300. Okay, so there's balanced billing there. So I just want to bring that up into your attention. You want to think about this for something catastrophic, but there are some gray areas because they're only going to apply what they would cover in network. Any questions on the medical benefits? Okay, perfect. Moving on to our dental and vision, that's with United Healthcare as well. One thing I want to point out is that United Healthcare is not sending physical dental or vision ID cards. Their ancillary department has decided to go green apparently. So they are linked onto the app and they are on the portal. A little tip that I like to give is maybe saving them on a notes on your phone. You could save copies of your ID cards, including your GAP card. You could add it to your Apple Wallet as well if you have an iPhone. But there's no physical ID cards. You could always print it and have it in your wallet. I have some clients that do that. So with the dental, we did upgrade the dental plan. So Linda, do you want to talk a little bit about that decision?
Yes, so, you know, the great thing about Larry, he's very generous. And some associates had explained that they felt the dental was lacking. Also, physical therapy they had done and it wasn't covered as much. So, you know, we heard you guys, and Larry decided to add the physical therapy rider, which we did this year. And also we have the highest tier dental plan that is out there, which comes with definitely better benefits than last year. Also on that note, Larry is continuing to cover 75% of the cost of the healthcare. We have the 25%. So I just think it's a great shout out to Larry, and just another way that he tries to take care of his employees.
Perfect. Thank you, Linda. So let's discuss what some of those enhancements are. So this is a PPO. So same rule of thumb is going to apply as I explained in the medical. If you go to an in-network dentist, you're going to get more bang for your buck. Why? They have those contracted rates. So United will say, hey, Mr. Dentist, the most you can charge for a cavity is $200, and United's going to cover 80% of the $200. You want to go to an out-of-network dentist and they want to charge you $400, United's only going to cover 80% of $200, what it would cover in network. So if you want the most coverage, I recommend staying in network. However, if you have a relationship with the dentist, and you want to go out of network, that's okay. You do have some coverage there. Another tip that I put here is always ask dentists for a pre-estimate. A pre-estimate is they write all the services that they want to do and they submit it to the carrier. And the carrier will send back, this is what we cover for everything, so that there's no surprises. So I don't know if you guys have gone to the dentist and they surprise you with these things that they tell you are covered and are not. I said in our last meeting, dentists remind me of Spirit Airlines. They charge for everything. So if you want to, I always recommend doing a pre-estimate. Okay, so you know, and there's no surprises. This plan is going to cover 100% of 4 cleanings per year. It's going to cover 2 periodic evaluations and 2 x-rays, but you do have 4 cleanings per year. It's going to cover 80% of basic services, and oral surgery will now be covered 80%. So we're endodontics and periodontics, where last year it was at 50%. So that's one of the enhancements. The second enhancement is that implants will now be covered at 50%. We did not have implant coverage last year. Crowns, dentures, and bridges will still be covered at 50%. Orthodontics, now their adults will be able to have a $1,000 lifetime benefit A lifetime benefit means that if you use it this year, you can't use it again next year. So it's not a benefit that refreshes, you get it once. But now adults, last year was just children coverage. Now we have adult orthodontic coverage. The deductible $50 applies for your basic and major services. There's no waiting period. So if you have to get work done, once you can go do it the following day. And the plan is unlimited. So if you need to do 5 root canals, it's going to cover 80% of those 5 root canals for you. Any questions on the dental? No?
Linda, I have the best gap coverage. Brandy, everything beyond this is covered by your employment.
I'm sorry, I don't know what does that mean?
Brandy's a treatment coordinator at our dental office, so all of our stuff, past insurance is all written off at the practice.
Yes, that's awesome.
That is awesome. Dentists are expensive.
Yeah,
Yeah.
Just the
and my
dental.
buddy's an orthodontist, so we get our dentures or our braces and all that stuff through him pretty
Oh.
cheap, if not no cost. So
Oh, nice.
That's perfect,
Hey.
especially with all the kids you have.
yes,
Jessica,
exactly.
All you
Jessica,
need is a friendship with a vet and you're good to go because
Right,
vets and
that's what
dentists
we're working on, right? Yeah.
a question here. Is like the clinic 4 per year? That is per person, or is like for all the people in the
Per-
group
per insured.
per
So per
insurance?
person, yeah. So why, if you and your spouse are on the plan, you get 4 and she gets 4. You don't have to share them or fight over them.
Okay,
You get your own.
who knows?
Right? No, I know. Insurance, but like little fine prints, but no, it's 4 per
Yeah.
person. So the vision benefits are staying the same. Unlike your dental, gap, and medical, that deductible refreshes calendar year, this refreshes 12 months from your last visit. So if I go today, 1 year from today is when I'm able to use my vision benefits again. I have a $10 copay for exam, an additional $25 copay if I'm doing an exam for glasses or contacts, which is usually why we do that. So you're looking at a total of $35. And then they give you an allowance of either $130 or $105 to use. Okay. Like I mentioned, they do have in-network providers. If you stay in-network, you can get additional percentages or discounts off of frames. Warby Parker is one that's in-network. So you can either check on the portal or you can reach out to our team and we can let you know what providers are in-network. Any questions on that? No. And one thing that I've had clients ask, let's say you go do your eye exam at an out-of-network provider because they're your friend or you have a good relationship with them. You could still order your glasses from an in-network provider. Okay, so you can go do your exam, you can get your prescription, and then you can take it to one of those in-network providers so that you can get these benefits. So flexible spending accounts. There's a healthcare FSA and there's a dependent care FSA. Okay, the healthcare FSA has an annual maximum of $3,200. Okay, so with this annual maximum, you can only roll over $640. So when you're putting funds in there, these accounts are created so you can put in money away pre-tax. When you're putting funds in there, you want to kind of budget your family's healthcare needs so that you're not overfunding it because they only allow you to roll over $640. Okay. If there's anything left over that at the end of the calendar year, you lose it. Something I pointed out in my last meeting is that there is this website called fsastore.com. I just discovered this year and I thought it was super cool because it's taking forever. So it has all products that are considered FSA eligible. So it has, skincare, it has massage guns, this Oura ring, just everything that falls under FSA, you can go on here. So if at the end of the year you have some funds, maybe you can buy some Christmas gifts on here and you could use your funds. So just wanted to share that little resource with you guys.
An old-time Christmas club also, Jessica.
Right, yeah. And I have the Oura ring. I'm a big proponent of it. So yeah, this is for healthcare costs. We have linked on Navigator everything that falls under healthcare. There's a lot of things that fall under it. If you have to have dental work done or vision work, your glasses, you could use your healthcare FSA for that. Okay. Your dependent care FSA is an annual max of $5,000. There is no rollover, so you got to use the whole $5,000. This is for children under the age of 13. It'll be for preschool or nursery expenses, daycare, summer camp, after-school babysitter in your home. Cannot be for private school, kinder up. Any questions on that? Okay. Perfect. So these are the deductions. You're gonna have access to this booklet as well as when you're going through the enrollment process, just like you did last year, you'll be able to see all the deductions. At the end, get your summary of what the deduction will be with all the benefits that you decide to elect or if you waive.
And Vanessa, Jessica,
It's okay.
but now somebody could just choose medical and not gap if they wanted to. They have a choice of that, or it.
I would recommend strongly against it.
Right, but I'm just saying, I'm surprised that it's broken up into medical and
Okay, the reason we broke it up is because we're connecting to the carriers, and if we have it bundled,
Okay,
it won't connect and it won't feed over. So that's why, but
okay.
I could put a restriction that if they choose the medical, they have to choose the gap. We can discuss that after, but I recommend against it because then you're gonna have a $6,000 deductible and we're selling it as a bundle.
Yes.
We're providing it as a bundle, okay? So some resources with United Healthcare. I recommend downloading the app. There you'll have access to all of your ID cards. When you search for providers, all your plan information will be linked. So you're gonna be certain that you're searching in the right network. So I always recommend that. Healthiest You, that's the virtual visit app that we spoke about earlier. If you use any other virtual visit platform, they will apply a copay. So if you want no copay, you use Healthiest You. And then there's some fitness programs. So Motion, Linda, if you want to speak about your husband's experience with Motion.
Yes, my husband who works out pretty frequently, ended up getting himself a Garmin watch with the Motion. It was really amazing. But yes, we love Motion. We love Motion. And the Apple Fitness. Apple Fitness is great.
Yeah. So
What did he get, Linda? You cut out there.
We got a Garmin watch that was like $480.
Got it.
free.
Okay.
Yeah.
So Motion, if you're walking, you're running, anything like that, and you're wearing a fitness tracker as part of, your exercise routine, all you gotta do is link it and get paid for it. And you can get up to $1,095 a year. So just a little freebie. Apple Fitness, they're not gonna give you the watch, but they will give you access to the classes. And then Simply Engage, when you log on, it's just health and wellness challenges. So it's the new year. I'm sure we all have resolutions of what we want to do. This might help you. It'll ask you your sleep goals, your physical activity, food, nutrition, all of that. So that's another little freebie. There is a wellness program called Real Appeal. So I like to describe it as a free Weight Watchers. With that program, you'll have a one-on-one with a coach, and they will provide a program for you that will have, basically a meal plan. It'll have a physical activity plan. And after your first one-on-one with that coach, they send you a success kit that has a scale, a food scale. It used to have a blender. I'm not sure if it still does. And some exercise materials. So you just have to do your first call and they will send you that kit. And people that have done an average of 4 sessions end up losing about 10 pounds. So it's a great program and it's free if you want to look into that. And then Sanbello is like a free headspace. So it's a meditation app, a mood tracking app. So if you want access to that at no cost, that's linked through United Healthcare as well. So we're going to go through Employee Navigator just so I can give you guys a little refresher. But this is where you're going to elect or waive your benefits. But this is also a resource throughout the year as well. So I'm going to have to go through the process first. So let me go through this process. And you're going to check your information, check your address in case so we can have that correct. So if you need, a new ID card, we could send it over. So the correct address. You're going to add your dependents onto any plan. You're going to put the dependent information here. And then here's where you could see the difference in cost. So this is the cost for just myself. If I want to add my spouse, this is what it goes up to. If I want to add my whole family, this is what it goes up to. It is the same cost to add 1 child or 2 children on the employee child tier and on the family tier. Okay, so it's going to be the same cost regardless of how many children. So you're just going to go through that process for all of the benefits. And then when you get to flexible spending accounts, let me point this out. If you do not want it, please put do not want this benefit. I have employees that put 1 just to click next, and we are not sure if you just want to add $1 to your FSA account. So please put that you do not want this benefit, not interested, and you can move on, okay? So you're gonna go through this process, and then when you get to the end, you'll sign here, and then it'll show you what your full deduction will be per pay period, okay? Coming back to home, as I mentioned, this is your resource throughout the year as well. So we have here's my email, my information. We have your portals linked here. And then if you go to the document library, here you have the complete benefit summary. So if you click here in our booklet, we do, an overview, but here you have the complete benefit summary. If maybe you want to look for something else like an allergy shot or something, you have the complete benefit summary here. You have all the information for those wellness products, and you have your dental benefit summary, everything like that. So I always recommend that this isn't just something you could use during open enrollment. You could use it throughout the year if you kind of don't know where to go and just want access to your benefit information.
Jessica, are the Motion and the Apple Fitness primary holder, or is it everyone on the plan can use it?
It's everyone on the plan.
I know for Apple Fitness, it's 5 people that don't even have to be on the plan. For Motion, I think it's everyone on the plan.
Okay,
Everyone.
thanks.
Hey, Dom, that used to give you like a gift card. Now I think that is just the device. Yeah, my
Right.
wife work on that.
Oh
Yeah.
yeah, great.
Yeah.
I'm sorry. You will get a gift card if you don't choose anything in the shop, and they'll give you a gift card a few times throughout the year as you accumulate, points.
I think that
but
they
just-
used to they stopped giving gift card. I think that they was like accumulate. They keep accumulating. That's what my wife told me. Like they keep like accumulating. So at the end, you thinking like, well, you can exchange for some gift or I know some of those devices, something like that.
Yeah, it's pretty much the watches. There's Apple Watch, there's the Garmin.
Unfortunately, we don't use Apple. There's no Samsung.
Okay, Rob.
Huh? No Samsung.
Rob and
I mean, no
Brian,
Apple.
You Android guys.
Oh, you're one of those one? No, I'm
Yeah.
kidding.
That's
So,
gonna be like